Awareness Month at an important time to discuss the signs and symptoms so you can learn how to catch a stroke early. And today, Hartford Healthcare and the Hartford Yard Goats tonight are partnering to put a spotlight on Stroke Out Stroke community. Here today to tell us more about this is Dr. Tapan Mehta, an interventional neuroradiologist and vascular neurologist with the Ayer Institute, Neuroscience Institute at Hartford Hospital. Doctor, welcome.
Thank you for having me.
Very important topic here. So glad you're doing this tonight. First, what can you tell us about the importance of providing awareness and knowledge about strokes?
As we know, it is exceptionally important. Stroke is a major cause of disability worldwide. We see about 800,000 strokes in the United States every year. And if you look at it, approximately 2/3 of these strokes are actually preventable. Patients who are having major strokes, we can reverse a lot of these deficits as the technology for stroke treatment has revolutionized in past decade. Not only giving intravenous clot-busting medications, but we also have now minimally invasive surgical techniques where we can put catheters in blood vessels of brain and suck out those clots. And that can be a huge life-saving measure. But the most important thing is patients should be able to recognize that they are having stroke, and they need to know when, where, and how to seek medical attention. And that's why the importance in community regarding stroke knowledge and stroke awareness is exceptionally high.
All right, doctor, tell us what some of the signs a person is having a stroke and what should someone do in this situation?
Captures about 95% of the stroke. BFAST stands for balance, eyes, face, arm, speech, and last but not the least, time. So when someone is having stroke symptoms that involves off balance, changes in vision, if they are experiencing a facial droop or they are having a speech problem, the most important thing to do is by the person themselves or a bystander is to activate the emergency medical response using 911. The safest and fastest way to bring a stroke patient to appropriate hospital is through the EMS, when the EMS providers are closely observing them. Sometimes we actually get an earlier information even prior to patient's arrival to hospital from the EMS providers that we are bringing a stroke patient, so that way we can be prepared, minimize any kind of delay in treatment.
All right, doctor, we're running out of time. Tell us quickly about Hartford Healthcare and the Yard Goats event tonight, Stroke Out Stroke Evening.
It is a great partnership with Yard Goats. We are having this event, Strike Out Stroke, at 7 p.m. At the Yard Goat game. We will be honoring a large group of patients who has suffered stroke, also the healthcare workers who took care of them. We will be offering screening for blood pressure and further information on stroke awareness and knowledge.
All right, Dr. Mehta, thank you very much for joining us, and we will post a link with more information at WTNH.com. Thank you.